Hi, I'm Dr. Brad Guyton with Delta Dental. In addition to my day job, I also have faculty appointments at 2 universities and have been a practicing dentist for over 25 years. A pediatric dentist is a dentist that focuses on children, and typically they go to school for a couple years after dental school to get specialty training and to get comfortable in taking care of your kids. The child should start to see a dentist either when the first tooth erupts in the mouth and no later than the age of 1. The reason why we recommend this is because once the teeth are in the mouth, they're susceptible to things like tooth decay. Parents should be looking at their children's mouths for multiple things. First off is tooth decay, and these typically present as maybe dark spots on the teeth. Secondly, they may want to be looking out for the brushing health of the child. In other words, if when they brush the gums bleed a little bit, that's a sign of gingivitis. Lastly, parents need to keep an eye on the diet of the child. Things like putting kids to bed with milk or fruit juice or sugary beverages can decay the teeth overnight, and that can be dangerous for the child. Children being scared of the dentist is a common thing, and we have to be very careful as parents to make sure that we don't exacerbate that fear or feed the fear. The best thing you can do is trust the judgment of the dental professional and the team and the advice they give you before you come to the dentist. Don't make the mistake of scaring your child, trying to prepare them or over-prepare them for the possibility of a shot or something that might hurt. Most of the time, dentists and dental teams do a great job in calming the fears of our kids. Babies can get cavities once they have teeth in the mouth. That's the big issue, is if you don't have teeth in the mouth yet, it's very difficult to get a cavity on a tooth. Once the teeth have erupted into the mouth, they are susceptible to tooth decay. We sometimes get the question, can adults go to a pediatric dentist? And the answer is typically no. Most adults go to a general practitioner, and pediatric dentists tend to focus their time predominantly on children. One exception to this rule is special needs adults oftentimes are treated by pediatric dentists because they're trained in this area. A child's first dentist appointment is typically pretty fun. The dentist will come in, they'll see the child, they may take them for a ride up and down in the chair, they may introduce them to the light, to the water, to the drill, to other things that may make noise that potentially could scare a child. But the whole intent of the first visit is to get them conditioned to the fact that these are just small tools that will be used in the hands of the trained professional that the child does not need to be scared of. Oral health is very important for our children. 3 major issues that may arise in children are tooth decay once they have teeth. Children are also susceptible to gingivitis or inflammation of the gum tissue if they're not brushing properly. And third, also to make sure that any kind of trauma or infection does not exist in the mouth. If there's not a pediatric dentist nearby, I would talk to your general dentist and ask for a referral to someone that's in driving distance. And if that's not available, many general dentists tend to see children in their practices. If you encounter a dentist that does not see children under the age of 3, for example, please ask that dentist for a referral to a pediatric dentist or maybe another general dentist in your vicinity or your community that does see younger children.